Tonight, the Oregon Health Authority says it is monitoring 4 people for Ebola. This comes after they traveled to West African countries that are currently experiencing outbreaks right now. Fox 12's Sarah Hurwitz explains how this impacts us here at home.
The good news is OHA says this poses a low risk for Oregonians. It says those 4 people right now are asymptomatic as it continues to monitor them. While the risk to Oregonians is low, the Oregon Health Authority wanted to make sure it provided reassurance to the community.
Ebola is scary, and so we didn't want the media, we didn't want the public to think we're holding anything back. That's not what we do. But we also think it's important that people understand that the risk is very low. This is not a big deal. And public health is basically taking steps to keep it that way.
Dr. Richard Lehman with the Oregon Health Authority says it's working to determine if the 4 people have been exposed to Ebola and are periodically checking in with them to check for symptoms. It's not releasing which counties these people are from or any particular details around their visits for privacy.
Release of very specific information could lead to people actually being identified, and this could damage our ability at public health to work with these folks effectively, and it could also expose them to unwanted attention or even persecution, and I think we're all agreed that's not something anyone wants.
OHA says there's never been a case of Ebola in Oregon. Now, on March 4th, the CDC required all airlines to supply it with contact information for all U.S.-bound travelers who've been in Guinea or Democratic Republic of the Congo in the last 21 days, which OHA says is the maximum known time between exposure and when someone has developed the illness.
Minimal risk, no risk, essentially, to people who were traveling on the plane with these folks unless the person became ill, because Ebola cannot be transmitted. A person can't infect somebody else when they are asymptomatic, when they haven't become ill.
Now, as we're in a pandemic, you may have some questions about Ebola versus COVID, and there's some important distinctions to make. OHA says COVID is spread through respiratory droplets and is more likely to spread than Ebola. OHA also says Ebola is spread if someone is exposed to the blood or body fluids of someone who's ill with Ebola. And OHA says it's also in contact with groups who serve communities that are at higher risk of exposure to Ebola due to traveling to those regions. From the Mobile Newsroom, Sarah Hurwitz.